Hi everyone. This week we are going to begin to use the Site-Specific Data Item or SSDI manual. If you have not already done so, please download this manual. It is available in the Course Syllabus and Information folder on the Materials page of Schoology. It's the blue folder above the coursework folder. Once you are in that folder, click on the Course Specific Information folder. It's a lime greenish color. Then click on the title Required Course Materials, SIM Manuals. The file is titled SSDI Manual V1.7-September 2019. So that's the title of the manual that you want to download, and then save it onto your desktop for easy access. I advise you not to print this manual. You will not be allowed to bring this manual with you when you sit for the CTR exam. And you never know when they might do an update. So I advise right now not to print it. If you want to print the section that we're working on, that's feasible, but just know that next year there might be small revisions or updates, and then you'll have to reprint it. I know you're sitting there going, OMG, another manual. Yes, it would be really, really nice to have the SSDIs within the store manual. However, the COC is not the responsible organization for these data items. NACER is. So that's why there is a separate manual, easier when it comes to, updates and publications and things like that. And it may seem cumbersome to have it this way, but the store manual would be like 200 more pages if we added it. So it's not a bad thing to have this in a separate manual. Cancer registrars did not start to use site-specific data items until 2018. For patients that are diagnosed after January 1, 2018, then we assign this SSDI codes. For any cases prior to that, we have to use the collaborative stage site-specific factors, all right? We won't go into collaborative stage site-specific factors. Hopefully by the time you get out there in the real world and have to abstract, that any backlog will already be done and you won't have to worry about that. But learning collaborative stage is a whole nother semester course. So the concept of the two data field systems are the same. But to make a long story short, when cancer registrars entered the codes into the collaborative stage data fields and some of the site-specific factors, the AJCC and the summary stages were auto-derived. But the system became too large, too cumbersome, and cost too much money to maintain. So we had to get away from that separate collaborative stage database and go with the SSDI manual and a whole new concept of entering those data fields with the programming behind it. So now we collect the SSDIs and assign the AJCC and summary stage manually, all right? Which many of us still did when it wasn't required for us to do it, and we use the collaborative stage, instead. But now we have to manually do it, which is fine because that helps us understand, the cancer disease management, or how it works and what's important with staging and why we stage, and it helps us understand treatment better. So just know this change, it was a good one. Okay, and yes, it's one more manual, but we can do this. Okay, enough history for today. It's not like you have to memorize those dates or anything like that, or you won't be tested on it. Just know that SSDIs, if the patient was diagnosed as of January 1, 2018, those data fields have to be collected and recorded. For this week, you need to read the introduction and general information about the SSDIs, pages 13 through 29. Some of this information may not make sense to you because you never use the collaborative SAGE system, but some of it will assist you in understanding why these data items are so important for us to collect. So if it's talking about history or what was done, don't worry about that. Just concentrate on the information that they're giving you about using these fields now. Pages 26 through 29 discuss schema discriminators, what they are and why we must use them. Basically, these pages are explaining that when we assign the site code and the histology code into our software, the software automatically derives a schema ID and an AJCC ID. Once you do that, then the software will know which SSDIs you will need to complete for that case, as well as the staging categories that are allowed for that site and histology abstract. This way, every SSDI is not listed for every abstract you collect or record. This saves room and time. However, sometimes the primary site and histology only are not enough information for the software to determine the applicable AJCC staging algorithm. So additional information must be recorded in the schema discriminator data fields. At this time, there are three schema discriminator data fields, but there are no sites that require us to collect the third schema discriminator yet. The third is just there in case it is needed in the future. If schema discriminators are not needed, you just leave them blank in the abstract. You can see on page 27 and 28, sites and histologies that require these fields are listed there, okay? You only have to worry about those schema discriminators if they are, required to be collected. So if the site that you're working on or histology that you're working on is not listed there, there's no schema discriminator to enter, no information to enter. So it doesn't happen very often, as you can see by both lists. They're quite short. So, and in class, you will not have to worry about the schema discriminators, okay? Just understand what they are, when and why we must use them. For class, you'll know exactly what site to go to find the SSDIs that you'll have to record. I know this sounds all very complicated, but it's don't make it more complicated than it is. Just know that in the future, you might have to answer a couple additional data items because of something that's going on behind the scenes in the software, okay? It's not like you have to understand, the programming that goes on, in the background of the software to do your job. You just need to understand that sometimes we have to enter these data fields for you, the software, to do its job. When you use the SSDI manual, you will go to the site you are abstracting, just like you do with the summary stage manual. Since this manual is a data dictionary, each SSDI is set up in the same basic format. They each have been given a name, the link of the item or code is listed. In other words, how many characters is allowed for that code. Each SSDI is identified by an item number, and if there is an alternative name, it is listed. This is usually the old collaborative stage name the data field had. And then the AJCC chapter that pertains to that SSDI is listed just for reference. There is a description and rationale of the SSDI, and sometimes there will be a definition and additional information for some of the specific SSDIs, just greater information that might be needed to understand that data field. Then of course there's the coding instructions are listed, and then the codes that you would assign. Important thing to note about the SSDIs. The data field length or number of characters allowed in SSDI fields vary among each of the fields. Decimal points are allowed in some of these fields, are sometimes required in these fields, which they were not allowed when we were collecting the site-specific factors for collaborative stage. So having these differences between the different fields is good. It makes for more accurate and precise data collection. So make sure you use the correct format for each data item, okay? You're gonna need to look at the SSDI manual each time before you assign that code, okay? Need to make sure that you are recording it in the correct format. If you don't record it in the correct format, you're basically entering nothing. It's unuseful information. Also know that a single SSDI can be used for multiple primary cancer sites. So you might see many of these SSDIs for more than one cancer site when you're abstracting them. So you'll become more familiar with some of them more than others. AJCC sometimes provides test and site-specific rounding rules that are of clinical significance. So those rules always take priority over any other rules. But in the absence of a special rounding rule, we would use the normal rounding rule of round 0 to 4 down and 5 to 9 up. So if the SSDI only collects information to a single decimal place and the lab test result is 4.44, where there's 2 decimal places it goes to, we must record that result as 4.4, okay? If the lab result was 4.49, then we would record it as 4.5, because the 9 is 5 and 9, so we have to round up to the 4.5. So once again, you know, basic statistic, you know, it's very important that you understand these basic math concepts. The timing rule for recording lab tests is very simple. Unless otherwise stated in the coding instructions, if multiple labs were performed, we record the lab result done prior to the cancer-directed treatment, surgery, or other treatment. Remember, cancer-directed treatment includes surgery or other chemotherapy, hormone therapy, radiation therapy. and only record results that were performed within 3 months prior to the patient's diagnosis. If the test is older than 3 months prior to the diagnosis, it would not be recorded. You would basically ignore that lab result. When a data item asks for the interpretation of a lab test, code the clinician's or the pathologist's interpretation of the lab test as first priority when available. If there is no interpretation given by the clinician or pathologist, and the reference range for that lab is listed on the test report, on the results report, the registrar can use that information to assign the appropriate code. So you are being given permission to interpret the lab test results as long as the range is given on the report. So that's good. When there is no clinician or the pathologist interpretation, and there is no range reference on the report, the registrar should code as unknown, even though the lab result is given. Because if you're not given that range reference on the report, different facilities, when doing their testing, depending on how they do that test, the range might be different. So if the physician doesn't interpret the result, the pathologist does not interpret the results, there's no reference range on the report, then you must assign code as unknown. But remember, if there's that range there, you do have permission to interpret the results yourself. You will note that there is an Appendix A and B to this manual. Appendix A is used by the registry software vendors, and Appendix B pertains to collaborative stage site-specific factors. So you do not have to worry about using these sections of the manual. I've included this illustration of the visceral and illustration of the visceral and parietal layers of the lung for you to reference for one of the site-specific data items that we are required to collect for lung, which you'll be working with this week. It's always nice to have a visual of what it is that we're collecting. So this is just a nice visual of what is being collected for that site-specific data item for the lung. So it's just here for you to reference. I will review using the SSDI manual and looking at the lung and melanoma SSDIs during our study group webinar this week. If you have any questions as you begin to use the SSDI manual, please post them in my virtual office. All right. I believe this is the last new manual you will have to learn this semester, so you can celebrate. But don't worry, it is a pretty easy manual to use, as well as record the data items themselves. So have a great week, everyone. Talk to you soon.